it's Yaz from Yorkshire Peaches Therapies, and welcome back to another episode of Hop, Skip and a Jump. Today I'm joined by the amazing Sarah from Totally Pawsome Dog Training. I've known Sarah for roughly around 2 years now when she first brought her German Shepherd Mavis to the Yorkshire Peaches Therapies clinic. Through working with Sarah with her own dog, we have now got a wonderful professional working relationship where we can work together on cases, especially if it's dogs that have got behavioural issues and pain issues, because 9 times out of 10, these two things aren't isolated. There is such a huge correlation with pain and behaviour, but you obviously know that already. That's why you're listening to this podcast. So let's jump into it and see what Sarah has to say. Sarah, thank you so much for joining me this morning on the podcast to talk all things dog training. Now, I'm very passionate about working with ethical, force-free trainers, and we work together, but I also work with your dogs as well. So tell us a little bit more about you. How did you end up in this industry?
Right. So I've always loved training.
Mm-hmm.
I've got horses, so I always trained them, as in riding and stuff like that. And then I've always had dogs. My passion rolled over onto training the dogs that I had. And I was at a bit of an imbalance in my life at some point where I thought, do you know what? I wanna train dogs. That's what I want to do.
Mm-hmm.
Some might say it was a bit of a midlife crisis, but so I signed up to a dog training course, which was via the dog training college. Quite a few years ago now. I think I signed up 2021, maybe.
Right, okay.
So I was on the course quite a long time. And then I passed that 18 months ago. In between that, I had a dog that died and then a dog that we had to put down, and life happened. So I had a few sort
turbulent
of
things.
starts.
Yeah. Because when we first met, I think you were nearly qualified, because I've been working with Mavis. I nearly said her full name then. MD. I've been working with MD now for I think just over 2 years. That's when we met, and you were just coming towards kind of the final stages of qualifying as a dog trainer. So I've been working in this industry for, it'll be coming up to a decade, which makes me feel absolutely ancient. But on the flip side, you've been now in this industry for 18 months. If you were to go back right to when we first met, so it's all, I always say, like, whenever you're doing any qualification, whether that's training in physical therapy, so physio, hydro, massage, or training to be a dog trainer, you're training to pass test, like a driving test, right? And then that moment when you're out on the road, you've got your license, you've got your insurance, you've got your road tax, you're like, oh God, like it's absolutely terrifying. Can you reflect on kind of when you first qualified and some of the things that you came up against, or things you, I don't know, maybe you didn't feel so prepared for, or things you felt really prepared for?
Imposter syndrome.
Oh yes. Oh yes. Yeah.
And still deal with it now. Obviously, I'm still relatively new in the industry. You get cases where you think, what the fuck am I going to do with this?
You know what? Speaking as someone who's nearly got a decade of experience, you still get the same thoughts.
Yeah.
You'll get a really complex case come through and you go, oh shit, where do I even start with this? What hole do I plug first? And it can be very overwhelming. I still get imposter syndrome. It's really important, I think, in the industry that we recognise that, you know, imposter syndrome is a huge thing that the majority of us deal with. And there's the what is it called? The Dunning. Have you ever heard of something called the Dunning-Kruger effect? So
Yes,
you
I
might have
think
heard it,
so.
but the term
Yeah,
banded around. So basically, the more knowledge you acquire, the the greater the disbelief in your own abilities.
oh, absolutely. Yeah,
Because you think, oh my god, I'm learning so much, but yet there's so much more still to learn, right?
yeah,
And then you've got people who have very little knowledge who think they know everything, and that's a very dangerous space to be in.
yeah,
But with imposter syndrome, it's about recognizing it and going, no, I am confident, I am capable, and that's why it's really important that you have a little team of professionals around
yeah.
you just to give you that little lift when you need it, and also as a sounding board. So I know you've mentioned quite a lot that you have a group that you speak with.
Yeah, yeah. So I met quite a few people on the dog training college course,
Mm-hmm.
and we set up, even when we were all still on the course. Are you laughing at Mavis?
Yes, I just saw a little snoot come up onto the screen.
So we met through the course and we set up a Facebook chat. Um, and we're all still in that, and not only do we bounce ideas off one another, and we have, as you can say, coaching calls if we've got a really difficult case and we need help with it. We also chat about just random crap,
Just life.
like just life. Yeah, like I'll get a message on the group on the morning, and I'm putting the horses out in the field, and they're like, "Oh my god, I can hear your horses," because only one of the other girls is horsey.
So it's
So
very novel to everyone else
yeah,
who doesn't have a horse.
yeah,
But I think it's really important that we do, as people. We predominantly work on our own. We predominantly
yes,
work on our own. So it's like really you've built your own staff room.
yeah,
You've built your
massively,
own staff room, and it's important because every single person will bring something different to the table. So your experience with training horses will bleed into your knowledge of how you train dogs, and then someone else in that staff room might have a real special interest in separation anxiety or
yeah,
resource guarding. You'll all kind of find your own little niche, and
yes,
I think it's really important to when you're looking for your niche. There's no, I mean, some people it takes ages to find their niche, and
mm,
that's absolutely fine. It took me a while to find mine, which is obviously pain. What
yeah.
would you have you found your niche yet? Are you still working it out, or
Um, I think because, as me and you know,
right on cue?
of the devil. Mavis, come here, please. Come on. You've got your topple there. Go eat your topple. Um, as we all know, Mavis is a very sensitive girl, like
She
she's
is.
just shown us. And that anxiety and reactivity and how the brain copes and changes that
Mm-hmm.
is, to me, the most interesting thing
Mm-hmm.
ever.
Yeah. So
Really delving deep into why is that behavior happening.
mm-hmm.
Now, I know why she's just barked. Someone's just walked past the house
Mm-hmm.
on the pavement,
Yeah.
and she either smelt or heard, so she's lost her shit at it.
Mm-hmm.
But there's little intricate behaviors that if I wasn't busy, I could probably pick up and maybe either distract or do a little bit of counter conditioning with.
Mm-hmm.
But obviously, I'm busy talking to you. So, but yeah, that's really where my passion lies.
Yeah. So with the emotional component of behavior, that's where you're most happiest in. That's I always say to people, sit where your heart sings the loudest.
Yeah,
And
yeah,
if your heart's like, oh my days, like you've just found out a new piece of information about how emotion affects cognitive
yeah,
function, then that's that you're finding your niche, and
Yeah.
you'll keep niching down even
Yeah.
further and further the more that you learn and the more that you explore. So for me it was painful dogs, and then I'm sat in two brackets at the moment. I really love learning about the emotional component of pain, which still isn't massively understood with our dogs.
Yeah.
It's something that's quite prominent in the human research field, but that's because we can verbally describe
Yeah.
our pain and our emotions and how it makes us feel. For our dogs, it's a lot of guesswork, for want of a better word. So with Mavis Davis, obviously I've been looking after Mavis Davis now for over 2 years. Over 2 years, I
Yeah.
think it is. What would you say Mavis has taught you?
Oh, fucking hell. Everything. Absolutely everything.
Mm-hmm.
Compassion, patience,
Yeah.
um, yeah, just absolutely everything
Mm-hmm.
that I put into my work with my clients' dogs, this dog has taught me and more.
Yeah, she's like I said, she's a sensitive soul, but she's complex, is Mavis, and Mavis has also taught me a lot.
Mm,
I think sometimes, like when you've worked with dogs for years, it's not that you get complacent, but sometimes you can get a little bit comfortable. I'd say
yeah,
you get a little bit comfortable. Like, okay, I work with I call them spicy dogs. I work with spicy dogs. That's my bread and butter.
yeah,
Painful dogs that are very emotional. Yeah, I've got this. Mavis has taught me that she's acting as a reminder that the landscape of pain and emotion is continually changing. Just because I've earned that trust with her
yeah.
doesn't mean that when she's having a bad day that she's
She's
gonna
gonna
just
let
be
you off.
okay. Yeah.
Yeah,
She's like literally yesterday I put
yeah,
my apron on and she lost her mind, and I was like, what did it makes you reflect as a practitioner?
yeah.
Because I was like, what have I changed? What have I done? Well, okay, so she's just had a kick off outside. She's come
Hmm.
in here. I've had new flooring put in, so you can smell the new flooring. I'm still insulating the window, like, so. How can I expect her to just be okay with me putting my apron on? Because usually I already have my apron on
Yeah.
when she
And
sees me.
also,
Mm-hmm.
another thing I thought about yesterday was first time in my new car.
So no wonder when
Yeah.
so we've changed so much of the landscape. So we had new car, we had new time of day. It was an early appointment, and normally
Yes.
we don't do early appointments with MD. But she's she's coped with early appointments before. But we changed so much of the
Yeah.
landscape. So of course she was going, actually no, this
Yeah.
isn't, you putting your apron on isn't okay. So it was, I think it was me covering my face when I was thinking about. I
Yeah.
was in bed last night thinking about it, because that's what you do, isn't it? When you think
Yeah. Of course.
something didn't quite go to plan, what could I have done differently? And it was I think it was when I covered my face to put my apron on. She didn't
Yeah.
like that, but now I know that's a potential trigger, not just for MD, but for
For other
other
dogs.
dogs. Make
Hmm.
sure I've got my apron on before I open that door, so I'm not
Yeah.
doing, because it's weird, isn't it? I'm putting my
Yeah. Of
arms
course.
above my head, and I never do that in clinic.
Mm.
So no wonder she had something to say about it. We got her back and we got her down off the ceiling, but there was so many different factors. And I remember me and you having a conversation like, it's taking longer for her to come down off the ceiling, but actually when you sit and reflect,
Yeah.
so
Of
much.
how many new things in the environment, like most dogs, for example, my old shepherd Wilf, at the time when he was alive, I wouldn't have even questioned
Hmm.
bringing, for example, a new table and chairs
Yeah.
into the house.
Hmm.
With her, I'd be like, right, well, she needs to habituate to it. She needs to smell it. She
Yeah, yeah.
needs to hear the noise, because the chairs would make a different noise than these chairs.
Hmm.
Just random, stupid things like that.
But they are so important to
Yeah.
Mavis. So important to her. So I thought about the floor. I was like, the floor's different. It's going to feel colder underfoot, but but I didn't even think about the apron. But this
No.
is it. It's dogs like MD that are going to teach us the most.
Yeah.
And even though it may sound daft to us and it may sound rational, especially when we're talking about, say, for example, pain, we don't get to decide what's painful. The dog decides what's painful. We don't get to decide what's stressful. The dog decides. We don't get to decide what's a trauma event. The dog does. It's always the dog that decides. And would I rather her express that to me? Yes, absolutely. Because in clinic and in her life, we want her to feel confident in it, being able to make decisions about how her life's run. We
Yeah,
control so many
definitely.
aspects of it, and we want to give her that confidence. Would you say that's something that you help empower pet parents with?
Yes. Yeah.
Yeah. So tell us a bit
Um,
more about that.
yeah. So with all the clients I have, the majority of them, I'd say, are learning a new way of
Okay.
training.
Okay. Tell us about the new way of training. What's the
So not it's not necessarily a new way to say me and you and other positive reinforcement trainers, but to them it's a new way rather than reprimanding a dog for barking, let's say, you're going, thank you, here's a reward.
Yeah.
Thank you, here's a reward.
And that can be a real like mind bender for.
Oh, massively.
Do you think it's a generational thing as well?
Yes.
Yeah. Because why do you think that's because science has evolved, or maybe pets are seen as family a bit more than they used to? What's your thoughts on that?
I think it's a mixture of quite a few things. I think it's generational, because what I find with the clients that I have is I don't like to use older people.
Old school.
And I don't mean older as in like they're old grandmas and they're walking down the street on Zimmer frames.
Yeah.
But they're in that generation of maybe 50 plus. I'm only 10 years away from that. Great. Where they've been brought up of your alpha.
The old alpha.
Because I make no qualms about saying openly, I was brought up in that way.
I was also brought up in that way.
Yeah.
Yeah.
I've raised all my dogs, apart from her and Mac, the pup we've got now, in that way.
Yes. Yeah. And I think there's no I think sometimes we can carry a lot of guilt and a lot of shame for that.
Yeah, massively.
Massively so. But the same way that it's the same mantra that I use in clinic, and it's that you do the best you can with the information you have at the time. Yeah. I didn't know when I first started out owning, I say owning dogs, like having dogs in my life. So again, like even the terminology that I use is different when I reflect back to then. So I didn't know when I first started owning dogs that there was different types of training. I just thought dog training was dog training.
Yeah.
And when I first started out with Lily and Rodney, they were trained with a mixture of treats, but there was also lead corrections, okay? So yes. I used to use slip leads. And I'm very, very open about that because now when I talk about, obviously I'm not a trainer, I'm not a behaviourist, that is not my realm, but it wasn't until I started learning about whole body systems and the thyroid gland that I was like, I think there's a different way that we should be potentially doing things. And that different way of doing things involved me moving on to a harness, which had been absolutely berated previously.
Yep.
And that's just what I feel comfortable with. That's not to demonize people that use slip leads. I know a lot of working dogs have slip leads to get them on and off quickly. I know that some dogs walk okay on them and they're not, putting that pressure on. But I think it gets a little bit political, doesn't it? But here we are, we're going to talk about it. I think any piece of equipment has the potential to be aversive.
Oh, 100%.
Even harnesses. So my
Yeah.
boy Rodney, he has an aversion to harnesses. He has an aversion to anything bin on him. But he will literally pull and choke himself if I was to walk him on his... So he has to have a harness. He has to have a harness to go out and about. But that's because of his hypermobility and his health stuff. So what would you say to, say anyone that's maybe listening to this and they're going, well, what is this new style of training? How do I find out more about it? Is that something they can come to you and have a conversation with you? Yeah.
Absolutely, yeah. I'm really open to having conversations with prospective clients, people that might not even want to use me and do it themselves. And I'm trying to find my words now.
Yeah.
I'm all right. I'm a nice person. If I can help.
I was waiting for something profound, but
No,
do you know what? I'm all right, actually.
I'm all right. I'm a nice person. If someone, let's say, for example, I had someone get in touch with me a few months ago, and I sent him my prices over, and he said, I'm on benefits at the moment. I can't afford it, but I'll keep your number for if and when circumstances change. And we're like, absolutely, no problem.
Yeah.
And on the phone call that we had, we spoke about changing his collar to a harness because his dog pulled. So he texted me a few days later saying, I know this is really cheeky, but what sort of harness would you recommend? So I was like, link, sent it over, and he was like, thank you.
Yeah.
I really appreciate that. That's what I mean by I'm an all right person. I'm a nice person.
You're not a gatekeeper of information. This is why I have like free resources on my website. I do blogs. I do the podcast. This is all free information because I know that bringing your dog to me is a luxury, right?
Yes.
It's not a given. It's not a given. So, and I wrote my book as well to try and help as many people with their painful dogs as possible because I know that not everyone can afford to come to me. But that doesn't mean that I gatekeep everything.
Yeah.
The more people that know about pain, the more people who know about, fresh feeding for their dogs, ultimately is going to be better for the nation's dogs, right?
That's exactly how I feel. If exactly like you, coming to having a dog trainer or behaviourist or whatever in your repertoire of, as me and my clients call it, our village.
Yes.
Our village of people, having those sorts of people in that village is a luxury. And this day and age, I mean, we were talking about debts last night.
Yeah.
This day and age, people can't fucking afford it.
No, they can't. And people go, well, you shouldn't, but you shouldn't have a dog if you can't afford it. And it's like, right, do you know what I would prefer? If someone had a dog, would I rather them spend their money on an insurance policy every month or come in to see me once a month? 100% the insurance policy, right? I'm a luxury. But is there stuff that people can be doing themselves in order to enhance their dog's life? Absolutely. Even when it comes to fresh feeding. So I used it when I first learned about fresh feeding. I was very, very passionate about it. And no, you can't mix both fresh feeding and dry food because... And actually, I've mellowed out so much on that. I'm like, listen, again, we're in a cost of living crisis. Some people just can't afford it, and that's okay. That's okay. Do you know what? What we can do is let's have a look at how to read pet food labels, because something you're paying quite a lot of money for, actually, if you fed Aldi's own, I think it used to be, was it turkey and rice or something?
Right.
That has more protein in it than, say, some of the big expensive brands like your Royal Canin and your Hills and stuff like that. I
Yeah.
remember me and Adam used to like financially like nearly bankrupt ourselves to make sure that Snoopy had his Hills prescription food,
Yeah.
because I thought that was the only way. And
Yeah.
like I could look back and get really cross at the vets that recommended it, and there's so many things we could have done as a family, because it's shitting expensive, is that food. And we were skint, we were absolutely skint, but we were like, this is absolutely paramount for his health, so we
Yeah.
must do this.
Yeah.
I didn't even know that raw feeding was a thing. I didn't know it was there was another way to do it. So it's the same with training. It's the same with feeding.
Yeah.
It's the same with painful dogs. Like, if you don't know, how can you be expected to do any better? And I think for us as professionals, it's about sitting in a place with minimal judgment, and you listen with an open heart and open
Yeah.
arms and go, okay, I hear you. So if you know, say for example, you've got a 80-year-old woman with a massive Rottweiler, can we expect her to walk that dog on a harness?
Mm.
Potentially not. Potentially
Mm.
not. Does that mean that, this woman who's owned Rotties all of her life should never have another Rottweiler? This is massively irresponsible of her. No, but what we can do is we can help her problem solve.
Yeah.
We can help a problem solve by getting a good dog walker in, so the dog has, really big walks with someone who's maybe a little bit more able-bodied.
Mm-hmm.
And then we support through things like loose lead training, and
Yeah.
it's about building that tribe. So that's something that recently we've worked together on. We had you had a client that
Mm-hmm.
you suspected was painful.
Yeah.
Been to the vets and they were going, no, 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 can't see anything, everything's fine. Again, that's not bad mouthing vets. They have very limited time. Pain is very complicated. So I said, Sarah, come along to the first appointment. Check with the pet parent, but come along, because I think it would be interesting to have you there. I know I can trust you in that room, that you're not going to do anything daft.
Mm.
So I know that it's safe to have you in there because you've already been working with this dog. But that's how we work together.
Yeah. Yes.
So anyone that say that I know that's a positive reinforcement trainer and they're referring people to me, come and listen to what I have to say, because we're looking at the same dog but from different sides of the fence.
Yeah.
And
Yeah.
it's that building that knowledge in the middle to a bridge is where we're going to get the absolute best for the dog.
Yeah. 100%. I couldn't agree more.
Yeah, I think it's really important, and I think this is why, like, your staff room that you've built with your friends that you did the course with, that's mega important.
Yep.
I do the YPT staff room, so that's literally open to anyone for the price of a coffee. Let's jump on a Zoom and just have a chat.
Yeah.
Have a chat. I don't know everything. I absolutely don't know everything when it comes to business or anything like that, or like handling like client expectations. But I can just speak from experience and maybe just give you a little bit of a confidence boost. So sometimes
Yeah.
that's all you need.
Yeah. Exactly. And especially with our reactive dogs, and what I always say to my clients, you need that village of people. You 100% need it. It's like, for example, I know me and you spoke about it last night, Yaz. I've been in my, I'm going to call it a staff room now. I've been in my staff room this morning, and I've said to them what I said to you last night. Mavis is on anxiety meds. She's on 3 different types of pain meds. She's got mild hip dysplasia and possible growing pains, I think, was in it as well.
100%.
And you've spotted a few little other things. And like I said to you last night, and I said to them this morning, what the fuck more can I do?
You're doing everything. You're doing everything. So this was a really interesting conversation, because you'll have I've had moments like this in clinics. So you have a pet parent come in and say it's their first dog that they've owned. They've done their due diligence. They've gone to a good breeder. They've asked all the right questions. And then it was a 9-month-old golden retriever that came in. They'd really done their homework and still got a dog that had a genetic defect. And I was like, like, it's no, that it's just fucking sod's law. That's what it is. There's sod's law. There's no other way to kind of explain it, because they did everything. But the people who've gone on Gumtree and bought a dog, and they'll never have any behavioural stuff with it, or any, pain or anything like that. But is it a case of, because we're enlightened, we're seeing more?
Yep.
Because I think that a big component of it is ignorance is bliss.
Oh, 100%. I mean, I look back on Wilf, my old shepherd, and obviously I didn't know about body language back then, other than, as everyone thinks, a wagging tail means the dog's happy. So he was being a shepherd, shouting his mouth off at the gate, and I'm like, oh, his tail's wagging though. He's enjoying it.
Yeah. Again, ignorance is bliss. So it comes back to that Dunning-Kruger effect, and it's like this. It's like you peek behind a little curtain. So I always say to people, especially when I'm doing any training, once you learn how to spot a lame dog,
you'll see lame dogs
everywhere, because they are everywhere.
I do. Thank you for that.
You are
Thank
welcome.
you for inviting me on that course.
Welcome to the shit club of seeing painful dogs everywhere. Because that's actually what it is. Like, I remember doing I think I'd been a dog walker for 3 years or something like that. And it wasn't until I was taught about canine biomechanics did I recognise how to spot a lame dog. And I'd worked with dogs for a long time.
Yeah.
Been around dogs a lot. Like, obviously, if it was like a full-on, I'm not putting my foot down, obviously I could spot that, but not all the other stuff that comes before it. So part of my thing is, like, I love educating professionals. I've taught yourself, other trainers, groomers, dog walkers, like, clinical psychologists have come just to learn about stuff for their own dog, right? But once you know how to spot a lame dog, they are literally everywhere. So this is why it's so important that anyone that works with dog walkers, pet sitters, I've taught people who run pet taxis, about how to spot pain, because we need to do better. We've got a silent, epidemic on our hands of dogs that are painful, and if we are not addressing that pain, we start to see those behavioural changes. Those behavioural changes, if they're not managed, well, they just keep escalating, don't they? Until something happens that you can't come back from. So this is why it's so important. But I know this is something that you're very passionate about.
Yes.
Because, like, I'll get a video and go, yes, do you think that this dog's lame in its right hind? I'm like, yep, you've got it. Yep. You've got it. Yep, you're absolutely spot on. Correct. Well done. Like, but this is it. It's practice. But it's learning those foundations. So out of your current client base, as a rough estimate, how many of them do you think are currently painful? I can hear the cogs turning as you're rattling through your Rolodex of all the dogs that you're looking after at the moment.
I hate to say it.
I'm like waiting in suspense here.
Possibly every single one.
Yeah. I wouldn't be surprised.
Possibly. I mean, there are a few that are a bit, is it behavioural or is it pain? Not too sure. I haven't seen anything that makes me think that's definite pain.
Yeah.
But it could be.
Yeah.
Without delving deeper and unfortunately spending thousands
you're never gonna know.
X-rays, MRIs, everything like that, you're not gonna know.
You're not gonna know. And as well, like, it comes back because we've just had that recent report come out about veterinary fees. It's very difficult from my perspective and your perspective. to refer dogs sometimes for those that additional imaging, because it is very expensive. Again, it kind of loops back to the cost of living crisis that we're in at the moment, and people can't justify, well, hang on a minute, I've brought you in to help me with loose lead walking, and now you're telling me this dog needs an x-ray? Not happening. And that's no discredit to the pet parent, because they've come to you with an expectation of you're going to help with this.
Yeah.
But actually, you're doing the best by that dog by saying, do you know what? We need to address this first before we can do this. This loose lead issue is just the tip of the iceberg. We've got something else going on here.
Yeah. Yeah.
And having those conversations can be difficult, but
Very.
Especially when pet parents are like, nope, and they kind of do that head in the sand sort of vibes, and it takes a lot longer for them to kind of come to that conclusion as such. I've spoken to dog trainers who've come on my course, and, you know, they go away with the best intentions, and they go and start having these conversations and have lost clients because of it.
Yes.
Yeah.
And I've recently, as in the last day or so, lost a client. Now, it wasn't due to pain. It could have been due to pain. It was, they wanted a fix.
And there's no quick fix.
And I get it. 100% get it, because like I say, I used to be that person.
Yeah.
But now I know more, and she's taught me so much more. I try to delve into absolutely everything. Food, pain, behavior, what happened before the behavior started. You know, everything like that, because I find it interesting, but I get pissed off when my clients don't find it interesting.
Why aren't you interested in nutrition, for God's sake?
Last night I was on a coaching call with a few of my clients, and I was geeking out about the gut microbiome to them, and I was like, and this and this and this and this, and they were both sat there like,
what?
What are you on about?
That's it's when you're hyper focusing on something. So when I start talking about pain, I get like really giddy about it, especially if I'm like, oh my God, I've just found this new piece of research about T cell expression and how it, and like people are looking at me like, right, okay then. But it's just because we're super passionate about what we do, and
helping dogs.
That's ultimately what it's all about. Listen, Sarah, you're gonna have to come back on the podcast, because we have more to talk about. I said, like, literally, I always feel like I end us on a little bit of a cliffhanger when I do these podcasts, because I just find it fascinating talking to fellow professionals in this industry, because we all have something different to bring to the table.
Yeah.
Now, for those who are listening and they're like, do you know what, Sarah sounds like my cup of tea, where can they find you on social media, and what's your website name?
So website is totallypawsome.co.uk. Facebook is Totally Pawsome Dog Training Yorkshire.
And
I am. Sorry?
You're on Instagram.
I am on Insta and I am on TikTok, but off the top of my head, I do not know the names.
If they put in Totally Pawsome, you're
Totally
looking for
Pawsome Dog Training, I'll be there. You'll find me.
It's a blue and white logo.
Yeah, with my face and Mavis on it.
Mavis Davis, beautiful Mavis Davis. So, Sarah, thank you so much for your time. And thank you so much, everyone, for joining us on today's podcast. If you have enjoyed this session, please make sure to like, share, subscribe, comment. Make sure you check out Sarah on her socials. For now, lots of love to you and your dogs, and I'll speak to you soon. Take care. Bye.